in some ways that's great, but it's also a deterrent. We've lost the ability to delay gratification. We've, kind of gotten away from this idea of, we're in this for the long haul. It's like, how can I fix this problem right now? And if I'm not seeing solutions right now, then I don't want anything to do with it. Then I see that all the time when I'm trying to teach mindfulness skills to patients. I tell them, like, this takes time and it's going to be hard and it's going to be more difficult before you actually see the benefits from it. And they'll come back after a session and they'll be like, it didn't work. Okay. You're not going to see transformation in a week. Right. Just like you're not going to go to the gym and all of a sudden, be lifting massive amounts of weight, or you're not going to drop a ton of weight when you make nutrition changes in 1 week. And sometimes people, their progress is a little bit faster in the beginning than not, but, sustainable, reliable change takes time to build.
Welcome to the Confident Mompreneur podcast, where you can find solid advice along with warm guidance on motherhood, business, relationships, health, wellness, and everything you need to help add to your confidence and zest for life. And with interesting guests from all around the world, you'll hear real and relatable stories with impact and nuggets of wisdom to help you or the mompreneur meet the challenges of life with clarity and success. Now let's welcome your mompreneur host, Kyrie.
Welcome on today, Dr. Jessica. I'm so excited to have you here.
Thank you so much. I'm so excited to be here today.
I am loving the lip and shirt combo. If you guys aren't watching this, you need to look at her. She just looks fabulous. Thank you so much for being here. I'm so excited to kind of get to know you, hear a little bit more about your like story and what you're doing currently. So do you want to just start us out by introducing yourself a little bit, telling us a little bit about who you are, what you do, your family, all the good things?
Sure. Oh my goodness. That could take like the whole podcast, but I'll keep it short. So I am a licensed psychologist in the state of New Jersey, and I actually have the ability to treat in over, I think it's about 40 states in the country right now doing teletherapy. So, but my home base is in New Jersey. I'm also a clinical neuropsychologist and a certified school psychologist, but I primarily work in private practice right now. I have my own practice. I've had it since July of 2020. I am a mom. I'm actually a single mom. I actually got divorced during 2020 as well. 2020 was a busy year for my family and I. I have two girls in 4th and 2nd grade, so 9 and 7. And they keep me busy. Work keeps me busy. Life keeps me busy in all of the ways. And one of the things that's also a kind of a priority for me and in the undercurrent of all things I do as psychologist, boss, mom, is just how I, prioritize self-care, exercise, sleep, eating for me. Some days better than others, but it's a major part of not just my life and my day-to-day, but also the work I do with my patients as well.
Which I love, and I'm super excited to get into, because if you guys listen to this podcast, you know how often I talk about how important self-care is as women that are trying to do everything. And so I'm super excited about that. Tell me a little bit about like how you decided to A, go into this profession, B, start your own private practice, and what has that journey been like for you, especially being a single mom to 2 young girls?
I like made that face as how did I get into this profession? Because this was not the original choice. I went into college thinking that I was going to be like an international relations and business major, and I failed that class, like spectacular, like straight up an F. It was not for me, and I think everyone in the helping professions, like, I love working with people and I love helping people, but for me, it was like, I'm going to try to stay away from this as long as possible. And I realized during the course of my college career, like this is actually where I did belong. I love working with people. I love the application of science to the interpersonal relationships, both on an individual and group level. So I did spend a lot of my time in the beginning of my career more in research. When I graduated school, when I actually take a step back, when I was in graduate school, the idea of being a psychologist is doing therapy, which is a lot of what I do right now. But I was starting my career and I'm like, oh my gosh, I don't know if I want to do therapy all the time. Like, I don't know if I want to hear people's problems all the time. Like it is a lot.
Yeah.
And that's when I realized there was this whole other side of the profession. This is the assessment piece and the testing piece. And that was kind of how I found myself in the medical rehabilitation world as a neuropsychologist, working in a hospital on, with patients who had TBI, stroke, brain tumors, accidents, things like that, spinal cord injury. So it was a really nice intersection of the medical profession, which I kind of dabbled with the idea of going to med school for a hot second, and psychology, and working with families who are, quite arguably at their worst, whether it's themselves or a loved one who had something, pretty horrific happen to them. As I had my babies, though, hospital life is tough, because you think you're leaving at one time and then something happens and then you're not, and that's difficult to keep up with young kids. So right after I had my second, I found myself working at two different private practices. One had more of a dementia focus. One was just more of a general private practice where I did therapy and assessment. So I had a nice balance. I eventually kind of consolidated into working just for one practice. And then COVID hit. And for a number of reasons, I found myself in a situation where I wasn't happy where I was at. I wanted to do something a little bit different with my career, have a little bit more autonomy and say over what I did and how I did it. And, kind of simultaneously, my marriage had been struggling. And in order to make the career change that I needed to be able to take care of my children, I opened my own practice. So it was really like an interesting intersection. I was a COVID casualty, but in a good way. I was actually grateful for COVID. It kind of accelerated some of the changes that I needed to make. So fast forward about 4 years later, here we are. The practice has been here for about 4.5 years. We've hired other psychologists, other staff members, other therapists, considering a second location, and trying to juggle being a mom and being as present as possible for my kids, and being at, as many of their things that I can. I coach their field hockey, their rec field hockey team, which is most of the time it's fun. It's difficult coaching your own kids sometimes, but it's no different than kind of every mom in their own journey. It's just my details look a little bit different, and how I put my supports in place, and learning to ask for help and being okay with that too. So
yeah,
a lot.
Yeah, no, it's great. And I think it's so cool, how a lot of us felt like we were going to do one thing with our lives, and then something happened to flip that on its head and make us reevaluate like what's actually important and how we're going to be able to create impact while still taking care of ourselves, taking care of our families, and doing all of those things. So it's really cool to kind of just like hear your story and how you've taken some of those maybe hard moments, from life, and created such beautiful things out of it.
Yeah, thank you. No, and it's interesting because during the earlier stages of my marriage, and when I was having my children, that's when I had let the exercise piece, self-care piece, really slip, as a lot of moms do. But
Yeah.
I was an athlete all growing up, and it was such a part of my identity, even in my 20s and 30s. And then motherhood and marriage and life hits, and it was something that slipped. And I started working out again, right before COVID. And when I really started to commit to working out, that's when I realized that, as I started to move my body and reconnect with my body, that's when I kind of really started to sit with the idea that like I needed to make some major changes, because I wasn't happy with where I was at in my life, the choices I was making, how I was making them, and why I was making them. And exercise really was such a conduit for me to not only make the changes, but really connect with myself and sustain myself through some really, really, really difficult, but pivotal points of change in my life. And I lift heavy weights 3 times a week. I try to go to yoga at least once, sometimes twice a week if I can. It's a non-negotiable for me. It really is.
Oh, I love that. And so much of what you just said, like, rang true with me 100%. I also went through a divorce. Mine was in
Mm-hmm.
2021 after COVID, kind of.
Mm-hmm.
And same story though. I was like a college athlete and did all the things, and then I got married, and then I had kids, and that kind of like withered away. And as soon as I got divorced, I got back in the gym, and now I'm a competitive power lifter.
I was going to say, I see that you're getting into it. I've seen your Instagram. You're
Yeah.
inspired. We might have to talk weightlifting at some point,
Yeah.
because That's some impressive stuff that you're putting up too.
Thank you. I appreciate it. Yeah, it's been so good for me though. And like you said, that kind of like mind body connection that gets like regenerated through that movement is
Mhm.
so pivotal and so important. And I found that I do a lot of my very best thinking when I'm in the gym because I'm solely just like out of my own head and into my own body where I can really focus and kind of myself can come through in the best way.
There is something to be said about the clarity that comes with a good workout, especially lifting. I get it 100%.
Yeah. So you talk a lot about like how it's been part of your personal journey to like create that mind body connection through working out and the self-care portion of that. How does that now integrate into what you're doing professionally?
It's just as it's a non-negotiable in my own personal life, it's a non-negotiable, with the patients and families that I work with. As you know, someone who's in the medical profession, we pay attention to the literature, and the evidence is overwhelming, regardless of age or diagnosis, illness. That exercise is essential to health. Movement is medicine. I say that all the time to my patients, not just from a intervention standpoint, but also a prevention standpoint. The medical model in the United States is one that's focused on treating a problem. I like to focus on treating the problem, but also how can we prevent the problems from even occurring in the first place? I always say to my patients when I'm starting to work with them, like I do a systems check at some point during most of my sessions. How are you eating? How are you sleeping? How are you hydrating? How are you moving your body? And what does your self-compassion look like? How are you holding space for yourself? How are you kind of emotionally taking care of yourself? And it's so interesting that if patients come in and they're not having a good day, a good week, whatever, first thing I do is, okay, well, let's check in. What are you doing? And I've never had it happen where they're like, I'm doing all the things and like life is still tough. Usually it's like, well, I haven't worked out this week. I haven't really been eating. I haven't had anything to drink outside of alcohol and coffee. And there's just a direct connection, both anecdotally in sessions, but also, like I said, in the research about what the role of exercise and nutrition plays in mental and physical health. So I almost feel like I wouldn't be doing my job if I didn't focus a lot on those pieces clinically, as far as people are doing from a mental health standpoint, and then, referring and pulling in professionals that might know a little bit more about certain things than I might, because I do the mental health thing really well, but there are, nutritionists and trainers and people who are specialized in doing other things. But, when you work collaboratively with those allied professionals, some really nice things can happen.
Yeah, which I love that. I always love collaboration, especially when it comes to the medical front, because there are so many pieces of everything kind of trying to work together all at once.
Mhm. Oh,
I
1,000%. Like I can talk about, nutrition and what's important from, a muscle mass versus fat standpoint, but I'm a psychologist. I can't take into account if somebody has a health condition that they need to be mindful of what and how they are eating. So, it's important for me to recognize that these things are essential to their mental health care. And let's pull in some of the experts that might actually be able to give you that really individualized plan that you'll need to be able to succeed.
Yeah, I love that so much. I also love that you talk about like, we all know that exercise is something that we should be doing, but I think especially as women and busy women, we always tend to put ourselves at the bottom of our priorities list. And so
Mhm.
even though we know it's something that we should be doing, a lot of us are not making the time for it. And I think it's really important that we recognize that, yes, it is hard to do. Like, there are definitely days where I'm like so busy that I don't think that
Mhm.
I'm going to be able to make that time for it. But if you create it as a priority and really build your life around it, it makes everything else so much easier.
No, I agree. It is so easy, especially as a parent, and as I can speak to a mom because that's what I am, to prioritize other things, especially when you have little people that are relying on you. And it took me a really long time for it to sink in and to truly buy into the fact that if I am not at my best, then I can't show up in the way that I want to for my kids, my staff, my patients, my life. And it goes into my workouts go into my calendar, and they don't move unless I am super sick, or like sometimes if I go to yoga in the morning, like if I did not get a good night's sleep the night before, or if I just need to, if my body needs sleep more than movement, then that's going to be the only thing. But honestly, even then, like for me, movement can help with fatigue. That's, I try to drive home with a lot of my patients. Like, I'm tired. Like, okay, well, movement will actually get oxygen flowing. It'll get blood flowing. It'll help you to feel better, and probably help you have a better night's sleep that next night as well. So it's a choice. It's a choice like everything else. It is a very, very hard choice, especially with the busyness of life. And for me as a single parent, there's, yes, there are times when my kids aren't with me and things are certainly a little bit easier, but that's also when I do all the other things for me, my own doctor's appointments, my own things. I take my kids to the gym with me if they're with me on the weekends. Like they come, it's just that, like, and they entertain themselves. Sometimes they even work out with me, and it works. And it's also really nice to model to them that, how you take care of your body is important, but also that, my needs are important too. So if they end up becoming mothers at some point in their life, I want them to know that it is okay and actually essential to take care of yourself first before you take care of anyone else.
Yeah, absolutely. I love that so much. I just did an Instagram reel today that said, like, don't, what did it say? It said, follow your plan, not your mood. Because it's so often that we let our mood like dictate what we're going to do, and instead we just need to follow through, because like you said, once we do the thing, we're going to feel so much better, and it actually positively impacts our brains from going and doing that thing. Like the serotonin release that comes from it is so massive.
Correct. I think that was the reel that you had. I think that talked about discipline and motivation. Was that the one that you had posted? I think that was one of the ones that you did. And I agree. And I think if you talk to any person in the entrepreneurial space, there's all this conversation about, motivation is more emotion and mood based, where discipline is the consistency. I had actually posted something on one of my accounts, I think over a month ago at this point. One of my favorite poets that's in the the Instagram space, she had talked about not even just discipline but devotion, because when discipline, like, we can show up every day, but discipline also can have, it feels for me a little bit rough around the edges, because sometimes inherent in discipline is also punishment. But if we're showing up for ourselves in a consistent way, as discipline also suggests, what if we think about it in the frame of devotion? Devotion is love. So if we're really wanting to show up and take care of ourselves in this self-care space, what if it comes from a place of love? What if it comes from a place of, I want to take care of myself because I love myself and I believe that I am deserving and worthy of the care that we as mothers so readily give to, our children and our families without even thinking about it. But if we don't even show ourselves a little bit of that, what does it say? What does it say about ourselves? So, we think about parenting and I'm devoted to my children. Okay, great. Be devoted to your children, please. But also, can you be devoted to yourself and put yourself on that same pedestal that you put your children as well?
Oh, I love that distinction. I think that's so good. And it's so true, because like you said, that word kind of brings back like the idea of, I guess, harm, or like, that we're in trouble for something, discipline.
Yeah. I mean, there's two sides to, actually, it's, I'm blanking on who, I think it's, I'd have to look up her name. I'm blanking on it. But so when she made this post, I actually like went and double checked the definition of the word discipline. And there's two sides to it. There's the consistency piece, but there's also this punishment piece.
Yeah.
Exercising, nutrition, sleep, it shouldn't come from a place of punishment. I don't even like the word should as a clinician. But what if we just challenge ourselves to think about how we take care of ourselves, what we put into our body, how we move our body as a sign, as a act of love, most importantly.
Yeah. Well, and I do think that's so important, because for so long, I thought of like the gym and exercise as kind of a method of self-hate, right? I
Mhm.
went because I wanted to love myself more. I wanted to lose weight. I wanted to do whatever it was. And instead, when I started focusing on I'm doing this because I love myself, because know that this makes me feel better, because
Mhm.
I, do my best thinking here, it completely changed the way that I approached the gym, and it made it easier for me to be more committed to it, right? Because if
Oh,
you're going to
1,000%.
something because you hate it, like that's a totally different vibe than if you go because you
Yeah.
love it.
And even to kind of tie in, some of the work that I do as a psychologist, and my approach is, I'm a cognitive behavioral therapist. So I'm interested in kind of the relationship between thoughts, behaviors, and emotion. But my main point of intervention is kind of the behaviors. It's the what are you doing? So you can have the thoughts, you can have the emotions, and yet they're separate from kind of what you're doing and how you are showing up for yourself. And but part of that too is also when we can kind of reframe the the way in which we are showing up for ourselves, or the way that we're thinking about or perceiving or interpreting our behaviors, it sometimes can make the behaviors a little bit easier to do. Things aren't anymore, a way of a form of punishment, or a form of I have to do this because I want to lose something. Positive reinforcement doesn't just work for kids, it works for adults too. I'm going to show up for myself, not because I need to lose something, but because I want to pay attention and get in touch with this feels good. It feels good to move my body. The results are a stronger body, more energy for myself, my family. And we think about, again, the rewards that we get for showing up. No one feels bad after a workout, even a
Yeah.
not great workout, but you might not be happy with it. I've certainly had days where I show up for the gym and I'm like, I can't even, like, I love to deadlift. Like, I'm like 30 or 40 pounds away, off of what I know I can max. And I'm like struggling with the bar. But you know what? I showed up and I felt great after I moved my body, even if it wasn't in the way that I wanted to. So,
Yeah.
how we think about the actions and the emotions about it are important. But when we can also show up consistently from a place of love and choose ourselves and focus on the behaviors and the actions that we're doing, it's going to make all the difference.
Oh, absolutely. I mean, I think back and I probably over that, 10-year period where I wasn't going to the gym or doing any of those physical activities, wasn't, feeding myself well, wasn't sleeping, all of those things, I always had this mentality of I can never follow through with anything. And it would show up over and over again in my business and,
Mhm.
attempting to be more physically healthy and all of those things. But because I like would constantly reinforce that in my own head, I like sabotaged myself and, would do exactly what I was thinking that I couldn't do. And then as soon as like I really started reframing that thinking and putting the action in to make it true, all of a sudden it
Mhm.
became true. And now it's like a regular habit where if I don't do it, then I actually feel worse,
Mhm.
you know?
Yeah.
And so just that mental switch that you can flip.
We can, even though, we think of behavior as something that is overt, I can like pick this up. I did something, thoughts are a little bit difficult or a little bit different sometimes because we can't see them. They're not tangible. But if we think of a thought as almost an internal behavior, and the goal is not to stop the thoughts, little therapy background, the origins of cognitive behavioral therapy actually focused on stopping thoughts. Like, I'm going to stop this thought in its track. And actually, one of the interventions, the earlier interventions for thought stopping, was to have patients wear like a rubber
Man.
band around their wrist. And every time they had a thought that they didn't like or wasn't a good thought, they snapped the rubber band. So, and we were actually using punishment as a way to neutralize or stop a thought. And look, for some people, it worked. Like, I'm not going to get in the way of that, but therapy has advanced because for a lot of people, it didn't. And if you tell someone to stop doing something, what are they going to do? A lot of times they're going to do it more. You tell your kid, like, don't have that cookie, right? Like my younger daughter, I actually found her this week. Gosh, I had like some candy in the house and I purposely hid it in an upper cabinet so they wouldn't find it, as a way to help regulate their choices around candy, because they have a sweet tooth just like me. And I come into the kitchen and my younger one is in her bathrobe, standing on the counter, rummaging through the top knits. And I'm just like, what are we doing here? Like, so me trying to stop her from having the candy actually made her want to go after it 10 times more. And look, like you say, oh, like she's a 7-year-old, they're going to do that. Well, guess what? Adults do that too.
Oh,
right.
yeah.
So for me, it's about, I'm not going to try to stop the thought. I'm not going to try to, inhibit my kids from having candy. Now, granted, I had to hide it because she also got up in the middle of the night and would just eat the candy while everyone was sleeping. So like sometimes those interventions work, but she really likes her candy. But, it's more just that, okay, the thought is there. These thoughts come in. Sometimes these emotions come in. And why am I doing what I want to do? Can we connect with the value of exercise, the value of nutrition, the value of sleep? Why is it important? How is it serving me? And how can it help me to show up? So, with my patients and my kids, when I realized that, okay, like the hiding of the candy thing isn't always going to work. It's a lot more conversations of, look, you guys can have candy and sweets. Like, I'm not a tyrant. I like that stuff too. And let's have conversations around like healthy eating. Let's have conversations around why eating, fruits and vegetables and, less sugary stuff is important. I don't want to scare them about like, oh, you're going to get like cavities and all that stuff too, because even that's a form of punishment. But when we can use our words and, as part of the overt behaviors that we're infusing, that this educational piece of, here's some other thoughts we can think about how we take care of ourselves, how we think about food, how we think about nutrition. I'm not going to stop you from having candy. Yes, there are boundaries and limits on it, of course, but I also want you to buy in to the idea of, if you want to have a strong body, if you want to be able to play with your friends, if you're going to want the energy for school and all your after school activities, that we need to nourish our bodies with healthy food and good sleep as well. So, we've evolved from them, and I don't want you to have this cookie, I don't want you to have this thought, to, what? The urges to have snacks and sweets are there, especially if you have a sweet tooth. The negative thoughts sometimes are just going to pop into your brain. Okay, how much are you investing in them?
Yeah.
How much are you investing in those negative thoughts? Or can we use mindfulness to pause and say, you know what, let me connect with why I want to eat better, why I want to show up for myself at the gym, and be consistent, not perfect, consistent in how we show up for ourselves and the choices that we make.
Oh, I love that. And it's so, so true. I mean, I've seen it over and over again in my personal journey. I mean, really, when I started going back to the gym, I think that kind of switch in my mind was that I was no longer going, to punish myself, like you said, but rather to help myself as I was going through some really big traumatic moments in life. And it gave me some sense of control over my life. I could
Yes.
control that one thing. I could make sure that I got up and I went and I took care of myself, no matter the chaos that was going on in my life around me. And,
Absolutely.
since that moment, I've been diagnosed with, PTSD, depression, anxiety, ADHD, all of the things. And so now it's basically a medical treatment for all of the things going on, with my mental health. And I recognize the pattern that when I was going, those things felt better. I was able to focus more. My ADHD wasn't bouncing all off the walls all the time. My anxiety and depression were so much lower, and all of those connections. And then once I realized, like, hey, this thing is actually really good for all of these other things that I'm struggling with, and it gives me some balance within the chaos, it made me just like want to go and do that all the time, every day.
I mean, you touched on so many important things too. And I think it's, when people are struggling with substantial mental health issues, it doesn't mean that they don't need more intensive medical interventions like medications or whatnot.
Right.
But as a psychologist, I'm focused more on what are the behavioral interventions that you can do to get better. I always tell people, pills don't build skills. They can be an important part of the treatment plan, depending on, what's going on. And it's not going to be what key, actually improves your life. It's an important tool, but what you do and how you do it is going to be what is transformative, not whether or not you take medication. But it's hard. We live in a world, and I can definitely, hold space for and empathize with the fact that we live in a world where we want what we want, and we want it now. And I think that's actually one of the downsides of technology, in that, you want information, you can get it quickly, and in some ways that's great, but it's also a deterrent. We've lost the ability to delay gratification. We've kind of gotten away from this idea of, we're in this for the long haul. It's like, how can I fix this problem right now? And if I'm not seeing solutions right now, then I don't want anything to do with it. Then I see that all the time when I'm trying to teach mindfulness skills to patients. I tell them, like, this takes time, and it's going to be hard, and it's going to be more difficult before you actually see the benefits from it. And they'll come back after a session and they'll be like, it didn't work. Well, okay. You're not going to see transformation in a week. Right. Just like you're not going to go to the gym and all of a sudden, be lifting massive amounts of weight, or you're not going to drop a ton of weight when you make nutrition changes in 1 week. And sometimes people, the progress is a little bit faster in the beginning than not, but, sustainable, reliable change takes time to build. And medication and other interventions can be a very important tool that helps us show up in a consistent way. But it's really the behaviors, it's what we're doing. It's, understanding, the times of day that might even be better to do certain things, like, or being flexible, that if you can't do it, like, I like to go to the gym in the morning, but sometimes I can't. Sometimes I'm going at lunch, or I'm going in the afternoon. Okay, those might not be my best workouts. And you know what? I'm showing up.
Yeah.
And that's just, can I show up those days is just as much as important as having, the days where, like, you're an absolute beast in the gym and, like, putting up, PRs left and right.
Right. Yeah. No,
And we love those days. Don't get me wrong; those days are great. But
I love those days.
But sometimes it's just the showing up.
Yeah, absolutely. No. And I think, as like, the oldest daughter, perfectionist tendencies in me have always really struggled with that idea. I think I've read so many books and listened to so many podcasts and everything where everyone was like, this is how you have to do it in order to be successful. Like working out in the mornings was one of the things that, they like would hit on all the time. I realize for me, that does not work. I do not like to wake up in the mornings and go and do that. I am much better if I can, like, actually break up the middle of my day and get that mental release kind of right in my little sluggish period in the afternoon. And so that's what I do. And that has been something that has really helped me. And I've been able to remain consistent in it because it's better with kind of what I need personally and not what everybody else says I should be doing or whatever. But I think it can be really hard, especially if you've got, like, some of those perfectionist tendencies, to realize that it's okay to take things in those bite-sized pieces and not be 100% like right away, and not lose 20 pounds in the first week, and not, like, be able to put up the numbers that you want every single day. But it's so important to just realize, like, if you're putting in the work, it will come with time.
Yes, I mean, a lot of the work that I do, with my clients is around expectation management. And sometimes we all need to hear the message over and over and over again that, like, you're not going to get what you want right away. And sometimes people don't want to hear that. Like, especially today and age, I think today's day and age, I think now more than ever, that's a really difficult thing for people to hear. They want results, they want change. I mean, that'd be great. And I tell people all the time, like, if I could make change happen, substantial change happen overnight, like, I would be on my yacht in the Turks and Caicos right now. Like, that would be beautiful. But it's more a question of getting and understanding that the skills and the strategies and the tools that are going to work for you, and how to implement them in a way that is going to help you get the outcomes. Like, I mean, you said a great example. You read any entrepreneur book or podcast or, something that's like, get up at 3:30 in the morning to like, conquer the world. And like, I happen to be a morning person, so that works for me. But I think the message is more of what's the time of day where you can be most efficient with the least amount of distraction. And for a lot of people, that's at 4 or 5 in the morning because kids are asleep, no one's emailing you, no one's calling you, and that's when you can focus on yourself. But if that doesn't work for someone, like, okay, then figure out what does work for you. And, be bold enough to kind of buck the norm and commit to what works for you, as long as it can get you the outcomes that you're wanting and needing.
Yeah, absolutely. I love that so much. I think it's also important, like you said, to tie in like kind of external things that motivate you, whether that's like having your kids come with you and see that and having them grow and their confidence, whatever. In the gym, my son also goes to the gym with me all the time.
Yeah.
And I'm pretty sure he thinks he owns that place with the way he walks in and like knows everybody.
My kids, oh my goodness. Same with my kids. They're crazy. They're crazy. They like run around like they own the joint. And it works. Like I actually work out with a trainer, and I make sacrifices in other areas of my life to have the resources to do that, because I need someone to tell me what to do. I need to be able to turn off my brain and go and not think, and know that someone is expecting me to show up at a certain time. Otherwise, like, it is a lot easier for me to give up on myself and get drawn into other things. It felt, it felt very selfish for me at first. It felt like a luxury, but I truly buy in, and it is a luxury. I'm not even going to say that's not. It absolutely is. But I make a lot of cuts in other areas of life to be able to do that, because I also I would rather invest in wellness than in illness. People are gonna spend the money somewhere. Either they're gonna spend it on maintaining health and longevity, or you're gonna get sick and have to put the money in there. And again, we exist in in a society where there is so much interest and focus on illness remediation and less so on prevention. But for me, I'd rather put that investment in myself now, so I can show up the best way that I can for my kids and myself.
Oh, definitely. And I always am of the mindset that if you don't take the time now, your body's going to force you to do it later. And
Oh yeah.
so like might as well make the time for it now. And like you said, making that investment and doing whatever it takes to create those systems for yourself where you can be supported and have like the scheduling and all of the things to make it the easiest for you. For me, when I became like a newly single mom after my divorce, the money was really tight. I didn't have an option to hire a trainer, and I didn't have anybody that like would go to the gym with me. And so one of my methods of like kind of self check-in, I guess, was that I would post a picture to my Instagram every day of me at the gym. And while that sounds stupid, it was something that like motivated me, like, oh, I gotta go and do my daily check-in, make sure, people know that I'm here and I'm doing the thing that I said I was going to be doing. And so whatever it takes to put those systems into place and make it easiest for yourself and remove those barriers to doing the things that we know need to get done.
Yep. When I guess I just started working out like with a trainer over the last year, but when right before my divorce during COVID, and when I first got divorced, like I had a Peloton, and one of my absolute dearest friends from childhood, he had a Peloton, and he lived in California, with his wife and his kids. And I was over here on the East Coast, and we rode together every night, 9:30 my time, 6:30 his time, which got, as my kids are getting older, like it was difficult for me to sustain. And I wanted to, invest a little bit more of my energy into lifting weights, but I gotta say, at least 4 or 5 times a week we rode. And there would be times where I would text him and I would be like, Ryan, like I can't even, like I am laying on the floor of my apartment right now. Like I cannot even, it has been a day I can't get up. And he would be like, I'm not like, get the hell up. Like, I'm not listening to this. Get up, get on the bike. You have 5 minutes to like pick yourself up and get on the bike. And I have two other friends who, I keep in touch with, who are, who work out a ton as well. And one of my girlfriends who lives down south, like, we're sending voice memos to each other in the morning. Like, she goes to CrossFit and I'm like, what did you do? Like, what are you doing at the gym? So it, knowing where to find your people to support you, whether it's the people like physically getting into the gym with you, whether it's using social media to help with accountability, or whether it's, in my instance, someone who lived sheer across the country. And like, I don't know how I would have gotten through like my divorce and even those first couple of years post-divorce, like without, him to help motivate and be consistent. It's owning into that. It's leaning into that, owning into it, or owning it, tapping into it, and just and showing up for yourself and knowing what you need to be able to do so.
Absolutely. Well, and as like, people around you, they care for you and they're going to help you try and be your best self if they really truly care about you. One of the things I went through some really major trauma, and afterwards I met my partner. So I
Mhm.
was really struggling with depression. And one of the things that my partner would do, as he was, kind of acting as like a caretaker to me during that point in my life, was that he's a trucker. So he's
Mhm.
gone and on the road a lot. So he couldn't be here to like tell me to like get up and get out of bed and eat
Mhm.
and go to the gym. He would call me around noon every day to make sure that I had ate lunch and that I was now in the gym, because he recognized that if I didn't have those things, my depression was only going to get worse throughout the day if I
Mhm.
was just sitting around not doing anything,
Mhm.
not taking care of myself. And so that was really a big thing for me, was like having somebody that cared enough to recognize that I needed to take care of myself and would help me be that person to like motivate me and get me there.
Yeah, look, I mean, like, I think part of it is recognizing like the different levels of need at different times.
Yeah.
And ideally, those like those hardcore, like intensive, like daily check-ins, it seems like that's not the case for you anymore, and that you've kind of evolved and been able to kind of self-motivate a little bit. But if that's what you needed at the time, okay,
Yep.
great. You recognize that and you allowed yourself to accept that. And it sounded like too, as you became stronger and stronger, both in body and in mind, that you were able to, just from what I've like seen from our conversation and just, looking at your Instagram and kind of learning a little bit about you as well, that you've been able to do more for you, kind of self-motivating, that self-devotion, that self-love piece. Because it might not have been there for you that much at a time when you were going through divorce and just kind of putting yourself back together and starting to, because I went through that process and still going through that process, myself as well, in terms of, you know, building up that love and recognizing that you are worthy of that love, not just from others, but also from yourself, and coming from a place of, I want to love and show up for myself the same way that I either show up for others or allow them to do it for me. It can come from within too.
Yeah, absolutely. Well, and I think it's really easy for us to show that love and devotion for ourselves when things are good.
Yes, a thousand
But it's
percent, a
not
thousand
so
percent.
easy to do it when we're like in those hard, dark points in life, whatever that looks like. For those that are going through something really difficult, they're going through their own mental health things, or they're acting as a caretaker for kids or a spouse or anything that's going through some really big, life changes. What
Mhm.
tips would you give them to making sure that they're taking care of themselves through that process?
Sure. I mean, and we can think about this in the context of a different way, or a few different ways. As a parent, it's obvious that this child, these children in front of me, I need to put their needs ahead of mine. When I worked at a dementia private practice, I ran caregiver groups, and there was again a lot of conversation about that my partner, my spouse, a parent, like they need so much care. What about me? And when I worked in medical rehabilitation, I worked with patients who had spinal cord injuries, brain injuries, and I worked again with the caregivers. And the people who either have become sick or they're not able to care for themselves in any way, it's like their life becomes the focal point of the caregiver. And it is so easy and to get lost in that, especially because caregiving is multifactorial. There's the obvious of like, I need to physically care for you and maybe help feed you or bathe you or groom you or, but there's also I have to make the doctor's appointments. I have to do the driving. I have to do all the things to help, the person you're caring for get to that place, while also taking care of the house, getting the food, getting the groceries, doing all of that. And what when I work with those patients or the caregivers of, the patients or parents, the message is still consistent. You have to find time for yourself, no matter how difficult it is. And as a matter of fact, you can't show up and take care of these people that you love if you don't. The biggest issue is that we've to some extent created a rhetoric and bought into the dialogue that the best way I can show up for everyone in my life, regardless of what their need or level of care is to let go of my own needs. Like, oh, I'm the best mom because I put my kids' needs first all the time. No, as a matter of fact, you're probably not. Or like my parent needs something, I need to just completely devote and give myself to them. No, you're actually not, because now we have two problems. Now we still have someone who needs care, and now we have a caregiver who's struggling. People don't think about it that way. Like that this ultimate giving is actually creating two problems, because that level of care, whether it's to someone who's sick, who's had an injury, parent caring for an older loved one, is not sustainable. It's not. There has never been an instance in my professional career or even personally that is sustainable. So if caring for a loved one is the utmost important thing to someone, then I would challenge them to make sure that they are taking the absolute best care of themselves so they can show up for that loved one. And, sometimes I've had patients, I've had moms, like, let's take a look at your calendar. Like, let's actually look at how you are managing time. And it's not a criticism of like, oh, you don't know how to manage your time. Some people struggle with this. Some people have ADHD. Some people have anxiety. Some people just there's nothing clinically going on. They just get overwhelmed. And they realize that, oh my gosh, I've been doom scrolling for, 2 hours a day, when that can be time that I can put into something else. Or like, if I get to bed a little bit earlier, then I actually have more energy to do some of the things that maybe I haven't been doing because I'm exhausted. So I think it's when you're a caregiver, recognizing that your needs are actually, more important than the person that you are caring for, even though the system is telling you that it's not, right? Like when you're pregnant, you have all these doctor's appointments. You have a child, you have one, and then the baby has all the appointments. You're caring for a loved one who's sick or injured, they have all the appointments. No one checks in on you. There's no doctor's appointments for the caregiver. We have to change how we think about the role of caregiving, and recognizing that we cannot give unless we are giving from our own place of health. And that's an important shift. How you put people around you to support that narrative is really important too. You'll never find people in my unit or in my world who tell me that, how I care for myself is selfish. Those people are gone immediately. Immediately. Because I know what happens. I am I am not a good person if I don't get to the gym. Like that is like one of my mental health plans. Like if you don't want me losing it on you, then I need to go work out. Thank you very much. So I can be a half decent human being.
Yeah, absolutely. And I've recognized in myself that a lot of resentment builds if I'm like constantly using everybody else as an excuse as to why I'm not taking care of myself. And so it like keeps that resentment from building, and I'm able to be a better mom and better partner because I'm getting the things that I need.
And look, like, I'm not saying it's not difficult, but I think that, to find time and carve it out. But I think sometimes we make it too difficult. If we can find the time to take a loved one to the doctor, do this or that, we can carve out time to work out for 20 minutes, to go for a walk for 20 minutes. It's again, this is where like working with a professional can help. It's how are the thoughts? What's the framework with which you're viewing the world, that it sometimes can be difficult to see what might be obvious to, a trained professional, where like, actually it's not that you don't have the time, just that your frame of the world is that you don't deserve it.
Yeah.
Or your frame is, as a caregiver, is that no, my needs don't matter because my worth and my value and my, my evaluation as a caregiver is actually, the outcomes for someone else.
Yeah.
Well, who said that that's something that we should be following? Like, what, and it is that actually, where's the data in real life that completely giving of yourself, has good outcomes both for the person you're caring for and for yourself?
Yeah.
It's not.
Well, and I always say that it's about having more intentional yeses, right? Because I think, especially as women, we tend to say yes to everything and everybody that needs something from us, when really, if we said no more, we would have more space to create that time for ourselves when we need it.
No, I agree completely.
Yeah. So as we're starting to wrap things up here, I know you love taking the science portion of this along with the psychology portion of this. What does the science say about how all of this kind of creates those mental links to create better mindsets and healthier habits and just like a healthier way of living?
Oh my gosh, that could be like a whole other handful of podcasts, because really the way the research is done, it's done by usually diagnostic category. It's done by age. Some of my favorite research to read is actually in the dementia literature. There are actually like randomized controlled trials where you take groups of people in their 50s and 60s who have no workout history and have kind of mild cognitive impairment, like the very earlier stages of dementia. And then you take another group of people and you put them on like a regimented workout plan. I think the one study I was reading is either like 12 or 16 weeks, like 3 times a week, 45 to 50 minutes of like pretty intense weightlifting, cardio. Like there's kind of a specifics with that, although I'm definitely more biased to weightlifting, and the research definitely kind of more supports both the mental and physical benefits of weightlifting, from osteoporosis, bone health, physical health. But either way, it's just intense working out, and they test some of their cognitive skills pre and post. And for the people who didn't have any regimented workout, we call that like treatment as usual, their cognition kind of started to was declining. But for the people who were on a specific regimented workout plan, most of them either maintained their level of cognition, or we actually saw some improvement in cognitive ability. So look, I'm certainly not going to say that exercise is going to cure every single medical or physical condition out there. That would be grossly irresponsible of me. But the data across age groups and condition, medical or mental condition is clear in that movement and exercise can help improve mood. It can help improve focus and clarity. It provides social opportunities, across all age groups, which is especially important for our children and teenagers. And COVID was a very stark reminder of that. We actually saw some data just recently come out that females, in particular, young females, their brains aged on average of 4 years because they lost social connection, whereas with men it didn't. The power of socialization for women is especially important. You tie that with working out, I mean, it's a no-brainer in terms of how you're boosting your mood, you're boosting emotional function, you're boosting those social connections, and you're improving your physical health, which we know wards off things like diabetes, high blood pressure, high cholesterol, and those can have pretty catastrophic impacts on mental and physical health down the line, because it leaves you more a greater likelihood of stroke, heart attack, to cancer and things like that. So like I said, it's something that I never not focus on with my patients. I try to also meet them where they're at. Not everyone's going to be getting to the gym. Not everyone's going to be lifting heavy. There are definitely limitations with what people can do, but it's a question of finding what works for people and making it that it's something that they can do consistently, also because they love it, not just because they have to do it. That's an important piece of it as well. So if we know that that's the case, like we want to talk about medication, okay, we can do that. That can be a part of the treatment plan too. But let's also talk about how we're going to integrate movement in, because we know that there are very few side effects, if anything, with exercise, unless you hurt yourself, which hopefully people don't. But there's only positive benefits to the role of movement in both short-term and long-term health.
Yeah, absolutely. So many good things that come from it. I mean, there's absolutely no reason that we shouldn't be trying to implement it in some small piece in our lives, even if it's going a day a week, just
Yep.
making those small
As a
changes.
way to start. Yep. As a way to start. And especially for patients who are struggling with depression, the idea of going 2, 3, 4 times a week might be too much. So I'll just say, look, can you go once? And can you go for maybe 20 minutes? And if you do more than that, great. But like, what's the minimum? And if they're able to do that, great. Then maybe can we go twice? Or if twice feels too much, maybe we can go, instead of 20 minutes, we're going for 30 minutes or 40 minutes. Making small, incremental, but meaningful and consistent changes is really what can drive better outcomes for both physical and mental health across ages and across medical and mental conditions.
Oh, so good. This has been such an awesome conversation, and I just love everything we talked about. I feel like I talk about it so often, but it's so fun to get to, hear your perspective on these things and really those like ties between our minds and the physical. And so, thank you so much for being here. I know we just like
Thank you
touched the
so much for
surface
having me.
on a
I
lot of
know.
these things. So where do we find you and learn more about you, what you're doing? How do we get in touch with you if we want to work with you? All of the things.
Absolutely. So, like I said, my practice is based in New Jersey. So for some of my East Coast folks, if you wanted to come into the office and work with one of us, we're in Northern New Jersey. The name of our practice is Elements Psychological Services. You can find us on Instagram at, I have to think for a second, at elements_psych. And then I also have my own Instagram page. It's dr.jessica.mccarthy. So if you give either a search, you'll find us, you'll find me, and you can connect to a lot of the good stuff and the good content that we're putting out, just as a way. We want to educate people. We can't get people in the door unless we create a comfortable environment for them. And this day and age, it also means online, with letting people get to know us, getting to know our treatment philosophies, and kind of what we believe in. And the power of education is actually a great way to do that.
Awesome. Love it so much. Thank you again.
Thank you. My pleasure. Thank you for having me.
Thank you for joining us today on the Mompreneur Podcast. And if you like this episode as much as we did, give us a follow so we can invite you back every Wednesday. And of course, share it on all your socials. Being a confident mompreneur means uncovering your strengths and struggles so you can dive in and learn how your next steps could be your greatest.